Good afternoon, Ms. Drinkwine. My name is William DeLeon. I'm a student of physical therapy here at UIW. I'm going to be taking you through just some questioning and whatnot about what's been going on and why you're here today. It should only take about 15 minutes or so, so thank you for your time. Would you mind confirming your date of birth for me?
I was born October 9th, 1994.
Okay, great. Thank you. And what do you do for your job right now?
I am a dancer at SeaWorld. I play the character Punky, which is like this large chipmunk type character. So I'm usually in costume, and yeah, that's what I do.
You said
I
a,
dance.
a large character. Is it a big old costume that you put on?
Huge costume. Yeah, it's got to be like 30 pounds at least.
Wow.
Yeah.
So what does your normal day look like, just kind of there at your job?
Usually it's just me running around, dancing, obviously, and I've actually worked there for 2 years, so I'm now the trainer of the dancers. So I'm usually choreographing with them, working with all the dancers, make sure they know the routine, um, just that typical stuff.
Are you on your feet, would you say, most of the day?
Yes, most
Okay.
of the day.
Do you ever get really breaks just kind of throughout the day or?
Here and there, I'll be working in the office, going over paperwork and like resting a little bit maybe for lunch, but that's about it.
Okay. And on top of the job, what other exercises or hobbies do you enjoy doing?
Um, I am. I go to the occasional happy hour with my friends, and I've joined a running club because I've been wanting to lose weight, so I joined a running club, and that's what I've been doing as well.
Great. Running's a great thing to start getting into. How long have you been doing that for?
8 months.
8 months.
Mhm.
Wow. Impressive. And when you go running, about how long would you say y'all go running for?
I would say about an hour or so,
An hour? And is that just once, twice? How many times a week?
3 times a week.
3 times a week.
Mhm.
Anything else besides that? Is that pretty much just kind of what you do on your free time when you get away from work?
Yeah, that's about it.
Okay. Now, can you tell me why exactly you are here today?
So I hurt my left hamstring, I believe.
Okay. And would you mind pointing exactly kind of just what area exactly it hurts in?
Right over here.
Okay. So right there, I'm going to kind of mark this and then I'll show it to you in a second and then you can kind of let me know if it's exactly where it is. Now, with that pain, do you feel anything just kind of down the leg with that? So
No.
below the knee or towards the ankle and the foot?
No.
No. Have you had any issues kind of with the hip or the back at all?
No.
No, it's just right there. Okay. How would you describe that pain?
I would describe that pain as more of a dull, achy feeling,
Okay.
unless it's unless it gets worse. Sometimes it gets worse, and when it gets worse, it's like bam, sharp pain. So
Okay.
yeah,
So it can get intense sometimes, right?
yeah, it can get pretty intense.
Okay, so right now, on a scale of 0 to 10, 0 being absolutely no pain, and then 10 being the worst pain that you can imagine, what would you rate it right now?
I would rate it right now to be about like a 6 out of 10.
Okay, so it's kind of bothering you right now?
Yeah.
Okay, and would you say the pain, do you feel it kind of towards the skin, or do you feel it like deeper into the leg? Where exactly would you say
Deeper
it is?
into the leg for sure. Like definitely not on the surface.
Okay, so a deep, dull, achy pain.
Mm-hmm.
Okay. And I kind of filled it out here. Is that kind of exactly where you would say it is?
Definitely, yes.
Okay. And again, there's nothing else anywhere that you might not even think has to do with the leg, but you don't feel pain anywhere else at all.
Mm-hmm.
Okay. All right. So, what types of activities caused your pain to get a little bit worse?
Usually if I'm dancing, which is a problem, so I can't dance anymore. That makes it worse. And then walking longer than 2 minutes anywhere. So.
Okay. So even short. So you haven't even been able to go to your running, have you?
Mm-mm.
Okay. All right. Anything else that you've noticed really kind of makes it feel worse, or is that about it?
No, that's about it.
Okay. And what types of things do you do when it's all kind of aggravated to kind of relax it?
Usually I just rest and ice it.
Okay.
My doctor told me to use rice, so So I've been
Mhm.
doing rice and I've been having medication, but that's about it.
Okay, and I'll touch on that medication here in a minute. So keep that in your brain. So, can you take me through how does your pain feel kind of like first thing in the morning when you wake up?
My pain, I just feel a lot of stiffness in my leg, and so that like sits there for a while, so that kind of hurts.
Okay, so with that stiffness, scale 0 to 10 from earlier, same thing, 0 being the
Mm.
worst. How would you rate that pain? Like first thing in the morning?
Probably that 5, 6 kind of pain.
Okay.
Yeah,
And how long does it take for that stiffness to go away? Is it very long or?
30 minutes at least.
Okay, so 30 minutes. And how would you say your pain is kind of throughout the day?
Throughout the day, it's kind of in that category. At least recently, these past 2 weeks, it's been 5, 6 almost all the time, except for like when I'm sitting in the office. That brief moment, it'll be like
Okay, so you're
one.
currently still working?
Yeah.
Okay. And how would you describe that pain towards the end of the day once you get home after work?
Well, towards the end of the day, when I finally can rest it and ice it, and I can have my medication, then it feels a lot better. It'll be a 0 out of 10.
Okay, so a 0 out of 10, that's good. At least we can get it down to no pain towards the end of the day.
Mm-hmm.
Okay, now I have some of the paperwork they had you fill out when you first got here. I noticed that you had checked yes for feeling a little bit down and depressed. Can you describe what's going on there a little bit more for me?
Well, dancing is always been a huge part of my life. So not being able to dance right now, it's really been hard on me. Not being able to dance, not being able to run.
Right.
I've been struggling with both of those, and then I've worked so hard for this position. I'm so proud to be a trainer now, and I can't even put my all in for my dancers because I'm feeling this pain, you know, and I don't want to look weak.
Right, and that's completely understandable. Would you say that you started feeling this way just after the injury, or?
Yeah.
Okay. Now, how have you and your doctor kind of been dealing with that?
Um, my doctor and I haven't really been dealing with that at all.
Okay. Well, if this continues or progresses, you can always just talk to me about it. And if you want, we can also kind of get in touch with your primary care, your doctor, and we can kind of talk to him about it as well. But it sounds like it's more from just the injury, and hopefully here with physical therapy, we might be able to just get you right back on your feet. So it'll start to be a little bit better. I also noticed here that it says you have about 4 drinks per week or so. Is that right?
Yeah, if the ladies and I go to happy hour, we'll have a couple of martinis. No, I don't drink wine. I actually really don't like it, despite the last name. But I'm a martini kind of gal, so I'll have a couple of martinis.
Okay, and it's just kind of occasionally. It's not very often.
Yeah, no, not that often.
Okay. As I continue down the form, I saw that you also put yes for anxiety. Is that how? Can you talk to me a little bit more about that?
Yeah, I've been anxious all my life. Anxiety is something that I'm very accustomed to, but I've had different outlets to deal with that anxiety. So when I was younger, I would cheerlead and dance, and now I'm just dancing, and that's really focused that energy. So anxiety hasn't been a huge thing. So not dancing right now and being in this state hasn't really helped my anxiety, and now I'm terrified to even be here because
Right.
I'm my friend who's been through PT said it was super painful, and I don't want to feel that pain. I want to dance again, you know.
Right. And here, if at any point in time you feel uncomfortable, you feel way too much pain, or you're starting to get a little bit nervous, just talk to me, communicate with me, let me know. That way I can make your experience as best as it is here, okay?
Yeah.
How would you say the depression and the anxiety are related?
I don't think they're related. I'm hoping too that I'm feeling down because of my injury,
Right.
and I feel like once my leg feels better, I'll be able to deal with my mood and everything.
Okay.
So.
Well, again, hopefully we can, here do everything we can to get you back on your feet, and you have your little coping mechanisms and whatnot for that. I see that you also put yes for prior surgeries and trauma.
Yeah, so I have gotten a right hip labral tear repair, like when I was like 18, so it was ages ago from cheerleading. So that was what I had there, yeah.
And you said that was how long ago?
When I was 18, so about like 5 years ago.
Okay. And have you had any pain with any of that recently?
No.
Okay. And you also put yes to morning stiffness, but we did kind of address that, correct? Okay. So have you had any x-rays or MRIs done?
I did get an x-ray and MRI done when I first went to the doctor when I first hurt my leg, and he said that I had a grade 2 strain of my left hamstring. Whatever that means, I don't know what that means.
Okay, we can get those records in.
Yeah.
And how about medication? Has your doctor put you on any medications yet?
Yeah, he asked me to take I don't remember what the medication was called. Some medication. He gave me some medication to help me with the pain, but
okay, and
yeah.
we can get in touch with him and kind of get what you've been taking as well. Okay. And let's see. Okay, so can you take me through exactly what happened with the injury?
Well, okay, so I'm a bit of a green thumb, you see. So I was out there with my plants, and I was trying to hang up a new flower pot in front of my house on a hook, and I was right underneath it is another flower pot. So instead of taking out the step ladder, I decided to step up onto that flower pot to hang that up. And this flower pot's like 3 feet high, so it's a pretty good height. So as I was standing on that flower pot putting it up, I felt myself kind of like losing balance a little bit, and I was ready to put my dog back, my foot back, but my dog was there, Max, and I didn't want to hurt my dog, so I stretched my leg out a little bit further, and I landed with the back of my foot, and my hip was still kind of like this. So I just landed really weird, and that's when I felt like this sharp pain in my left hamstring.
Did you fall on the ground at all, or were you able to stay on your feet?
I was able to stay on my feet. I stumbled a little bit, but I was able to stay on my feet.
Okay, and you said you kind of lost your balance there. Is that something that you've ever had issues with in the past? Or no? Okay. So the leg was it was straight. You said you landed like on your heel, and then right after that you felt that there was a pull.
Yeah.
Okay. And have you ever had any type of injuries like this before?
No, never.
None? Okay. All right. So, how would you say you learn best?
I'm a doer, so since I'm a dancer, I have to do the movements to really learn them. So
Right.
that's the best way I learn.
Okay, yeah. The only reason I ask is just so when you're here and we're kind of teaching you and showing you some of the exercises, we just want to be able to help like facilitate your learning process so it's as easy as possible here. Okay.
Thanks.
Would you say, do you have any barriers to learning possibly within any of the information that we're going to be giving you, or being able to make it here on time, or being able to do anything at home at all?
I don't think so. I mean, I'm just scared, so I don't know what else you can do about that.
Okay. Well, continue to just talk to me. Let me know anything at all that I can help you with to make this as easy as possible for you, okay?
Yeah.
And what type of goals do you have for physical therapy?
I just want my leg to feel better so I can dance again. I just miss dancing. I need dancing back in my life.
Okay, and we can definitely help you with that here, okay?
Mm-hmm.
All right, well, that pretty much covers everything on the first part of this. So we're going to do a little bit more stuff to test some muscles and whatnot to kind of see where we're at. So we'll go ahead and get started with that, okay?
All right. Okay. Thank you.
Mm-hmm.